Good evening, everyone. Today I have with me Dr. Udani, and we're going to be talking about what is the difference between homeopathy and naturopathy. So, just some housekeeping stuff. If you would like to book an appointment with Dr. Udani, our naturopathic doctor at the Justine Blaney Wellness Center, or even if you have any questions about it, about her treatments and her sessions, please feel free to give us a call at the number listed there. Or you can text Dr. Justine, which is our main chiropractor at the Justine Blaney Wellness Center, if you have any further questions. So these are our upcoming wellness talks for the month of May. So the next one we have on May 17th is the emotional freedom taping and stress reduction with Dr. Udani. A lot of great information there. The following week we have on May 24th is the our registered massage therapist Derek. He'll be demonstrating the cupping technique, which is a lot of cool stuff. And then the last week of May on the 31st, we have an amazing Theraball workout with Dr. Justine. So stay tuned for our upcoming talks, which are every Tuesday at 7:15. All right, so please welcome Dr. Udani. She's our main licensed naturopathic doctor at the Justine Blaney Wellness Center, and I also have a pleasure of working with her as well. So please welcome Dr. Udani.
Thank you so much, Crystal. Good evening, everybody. It's so nice to talk to you about this amazing topic today. So, this is actually a question that I get asked often, like, what is the difference between homeopathy and naturopathy? And what do I do as a naturopathic doctor? Like, do I do both? Do I incorporate that? And what exactly are the two? So, we're going to dive deep into the difference between these two modalities and talk about how they can actually work together. And then I'm also going to talk to you about what is naturopathy as well and how that can also help you in your healing journey. So, we're going to start off with homeopathy. So, what is homeopathy? So, homeopathy is a system of natural health that's been created worldwide for over 200 years. So, it actually originated in Germany, and homeopathy treats each person as a unique individual with the aim of stimulating their own healing ability. And there's many countries in Europe as well as Asia that practice homeopathy as a dominant form of medicine. And we're going to go delve a little deeper into what is exactly homeopathy is. So let's go to the next slide. So you might have noticed that a lot of homeopathic remedies come in these little pellets or liquid forms, and these are actually the remedies that you take in. And a lot of the treatments are considered remedies because they're derived from plants or minerals or animal sources. And there are over 400 different remedies. And the key with homeopathy and finding the right remedy is that each of these remedies have a different symptom picture. And you want to find the remedy that matches your symptom picture. And that would give you the greatest results with your healing. Let's go to the next slide. So, how do figure out what is your symptom and what symptoms are actually created by these remedies, and how do we figure out that is the right thing for you? So this is actually one of the principles of homeopathy, is that you have a healthy individual that tries this medicinal plant or mineral or extract from animal source, and they observe to see what are the symptoms that this person gets. And so then they know that this particular remedy can create these symptoms. So then you look at an individual that is already having these symptoms for because of an illness, and the extract of this medicinal plant, they create a remedy from that, and they give it to this individual. And if they get better, then you know that this is the right remedy for them. So the goal of homeopathy is selecting the right remedy that most closely resembles the symptoms presented by this sick individual. So when I was trained in homeopathy in naturopathic school, we had this big book that had a huge number of remedies and huge number of concerns that came in that were presented. So anything from headaches to chest pains to stomach aches to colds to ear infections, allergies, and there were so many remedies that were listed in under all of those ailments. So my job as a naturopath practicing homeopathy and as a homeopath that's practicing by themselves individually under that license is to figure out the right remedy for you, looking into your the symptoms that you come in to see me with. Let's go to the next slide. So how do you figure out what is the right remedy for you? So this is where it's a very holistic intake is what we do with the homeopathic intake. So we look at your main complaint, we look at some any other complaints that you come in with. What is your family history? How was your birth? Were there any issues when you were born, such as like developmental delays or difficulty with labor? What is your occupation? What are your interests? How are your relationships? How do you interact with others in your relationships? How is your childhood? So there's a big overarching view of like your health history, and it goes really deep into your physical, your mental, your spiritual well-being as well. And this is because everybody is different, so we want to make sure that we match you with the remedy that fits you to as close to a T as possible. And that's why we have a big book, and that shows like there's so many remedies to choose from. Let's go to the next slide. So these are some of the ways that we give homeopathic remedies to patients. So on the left side, sometimes I can't tell at my left from my right. We have the pellets. So these are the pellets that contain the remedy and different strengths of that. And you can take this sometimes according to your practitioner. This you take it every 2-3 hours, or you just take it once, and that's it. So that depending on the strength of the dose, you don't necessarily need to take it all the time. And same with the liquid form. You might not need to take it as often, but this is why it really depends on your case. And this is why we take a very thorough intake when it comes to homeopathy. Let's go to the next slide. So what are some common conditions treated by homeopathy? So homeopathic remedies can be really effective for children. Any kind of children's ailments like teething, colic, sinus infections, and ear infections. And of course, this is where we make sure that if it is a serious symptoms, and if the symptoms seem to be a lot serious, then we always recommend to be safe and to go to emergency room or anything like that. So this is where me as a naturopath would would suss out and rule out any emergent conditions. So homeopathy is also great for skin conditions, things like hives, psoriasis, rosacea, atopic dermatitis, and even allergies, allergy reactions, like especially skin sensitivity ones, mental emotional conditions. A lot of menstrual pains, PMS, fibroids can be helped with homeopathy as well. And in my opinion, with homeopathy, you have to make sure it is the right remedy. So this is where choosing a homeopathic practitioner with lots of experience, or one that is just has done a lot of research, done a lot of studying into homeopathy, can be really helpful to figure out the right remedy for you. And because these remedies are so specific, this is why you want to consult with a healthcare provider before trying homeopathic remedies, because it should not be used as the sole treatment, especially in emergency conditions. So just want to put that disclaimer out there that this is not the only tool that you need to use, although it is effective, that there are so many other tools that you can use. And in emergency conditions, you definitely want to listen to your intuition, listen to your gut, and seek out emergency help if it is an emergent condition. Let's go to the next slide. So we're going to actually go into what is naturopathy. So we talked a little bit about homeopathy and how it treats the person, the kind of intake it takes, what are the remedies, and what kind of conditions it treats. And so now we're going to delve into what is naturopathy. So what's the difference between the two? So a lot of the naturopathy is, we're also known as naturopathic doctors, naturopaths, or NDs, and we are healthcare providers. Then we use natural therapies to support. And as a naturopath, I have a wide range of services that can help people of all ages. And in Ontario, naturopathic doctors are regulated licensed professionals. So we have our College of Naturopaths of Ontario that regulates us so that we we offer the safest treatments as possible. So the next slide. So this is the naturopathic doctor oath that we have to say before we graduate from college and we pass our board exams. And I want to share this with you here because I really resonated with this oath. And this is one of the reasons I wanted to become a naturopathic doctor, was because I wanted to obviously first do no harm. I want to make sure that anybody that comes through my and see me with any kind of ailments, I give them the safest treatments as possible. And I wanted to cooperate with the healing powers of nature, because I truly believe that every one of us has the ability to heal, and nature has a wonderful, wonderful ability to heal as well. And there's so many components of nature, including botanical medicine, herbal medicines, and the different things that can help improve our healing ability as well. I always wanted to address the fundamentals of disease, which is finding the root cause of what is causing this illness and the symptoms in you, instead of just giving you a band-aid solution, and to heal the whole person through individualized treatment. This is where I love talking to my patients to get to know their full picture about what is going on with their lives and what started their illnesses or conditions that they're dealing with, so that way I give them the individualized treatment that they deserve as well, and I listen to them as well. And to teach principles of healthy living and preventative medicine. So this is a huge thing for me too, because I love teaching people. I love educating and helping everyone that kind of comes see me to get better, have better, improve their lifestyles and their health, because life is a journey, and learning about these different principles of healthy living and preventive medicine can go a really, really long way into your health. So this is the naturopathic doctor oath that I really resonate with, and this is one of the reasons I became a naturopathic doctor, because of this modality, this way of healing really spoke to me. So let's go on to the next slide. So we are trained in multiple things and multiple modalities, actually. So I call it my toolkit. So I've been trained in various different tools that I could use, and they're all natural based. So when you come in, let's say you book an initial intake with me. It's about an hour long, hour to an hour and a half. And this is where we talk about your full health history, including your main concerns, some other concerns that you might have. What is your lifestyle like, your diet, your stress, your sleep? What is your previous medical history? Have you been taking any medications, any surgeries or accidents or hospitalizations? And just to get the full picture of you and your health, because that really matters, because no two people are the same, right? So no two people should be given the same medicine, especially if they have different lifestyles. So that's one of the reasons that we do a full hour intake as naturopathic doctors. And homeopathic practitioners also provide a very long intake, because they want to also give you the correct remedy. So as naturopathic doctors, we also offer physical exams. So this is where we can get your heart checked, your lungs, your blood pressure checked out. And I usually do this with a lot of my initial patients to make sure we get a baseline of what's going on. And then we also trained in herbal medicine, so botanical medicine, acupuncture, traditional Chinese medicine. So a lot of my patients, I do offer acupuncture for them. So this is something that I love doing as well. And we're also trained in certain manual therapies like massage, cupping, soft tissue work, and of course, diet and nutritional support, and counseling to certain degrees. We can offer that as well. And with additional training, we can also give you hormone therapy and IV therapy. And also we are in Ontario, we can order necessary lab tests for you, and more comprehensive lab tests as well. And homeopathy is also another modality or a tool in my toolbox that I could use if I deem that it is necessary for you. That homeopathy would be the best. So there's a lot of tools in my toolkit, and this is that can differentiate a homeopath between a naturopath, is that we have a lot more tools in our toolkit that we've been trained in to offer. And I'll just add that as a naturopathic doctor, we do have to go through 4 years of an accredited program. So this is after an undergraduate degree as well. So all in all, it's about 8 years of learning to get to this point to start helping patients. So the next slide. So these are some of the common conditions treated by naturopathic medicine and some of the conditions that I personally see a lot. And this is, weight loss, depression, hair loss, fatigue, that brain fog feeling where you just can't remember why you came upstairs. Those are like symptoms of something maybe more serious. So we try to figure out what that is. A lot of my patients have digestive concerns, so constipation or diarrhea or IBS, IBD symptoms, infertility as well, migraines, headaches, managing stress. How can you manage stress so that you are giving your best every day? Chronic infections, colds and flus, and just feeling like you're always catching something. What's going on there? Anxiety and depression, can sometimes go hand in hand. So a lot of mental health complaints are also helped by naturopathic medicine. Joint pain, so arthritis, rheumatoid arthritis, any kind of joint pain, muscle pains, insomnia, eczema, acne, psoriasis, so skin issues, food sensitivities, and diabetes are some of the things that naturopathic medicine can help. And these can sound really, let's go back. These can sound really maybe like too broad, but if you think about it, naturopathic doctors are considered similar to family doctors. So we see all of this come in, and then we, depending on the situation, we might refer you to your family doctor to get additional testing, or we'll do additional testing. And this is just to show you that we definitely really do see a huge range of issues. And because of our intake is an hour long, we really get to figure out like what is actually going on. So let's go to the next slide. So I also wanted to kind of talk a little bit about how is naturopathic medicine different from Western medicine. And Western medicine is called allopathic medicine, and then naturopathic medicine is the naturopathic medicine. So I'm not here to say that either is better or worse than the other. Just to give you some differences between the two. So usually with Western medicine, it's often that you treat the symptom, right? So you come in and then you say there is a headache, and so the doctor might prescribe a painkiller, or they might say we need to do additional testing. Let's get you an MRI. Whereas in naturopathic medicine, we try to treat the root cause of what's happening with the headache. So if you have a headache, we try to figure out with the intake what could be the possible cause of this. So is it your diet? Is it your lifestyle? Is it posture? Is it something with the muscular skeletal system? And we try to figure out how can I get you the most appropriate therapy. That's also not just a band-aid. That's like not just controlling the symptom. So and then with Western medicine, it can look at the body as different parts. So I've had some patients that come in and that say that, I had this rash and I went to my doctor and they referred me to the dermatologist. And then there were some hormonal problems that I also came in and they referred me to the gynecologist. So there's a different specialty for different concerns. So a lot of times with Western medicine, you look at this only the symptom and in that specialty. So if let's say you ask a dermatologist a question about hormones, they say, well, I don't really know, I'm going to refer you to the gynecologist. Whereas with the or endocrinologist, sorry. So then with naturopathic medicine, they look at the person as a whole. So we try to figure out why is the rash, what's causing the rash. Is there a hormonal component? Okay, let's do some testing for the hormonal component. And let's also maybe you do need to be referred to a dermatologist. So let's talk with your family doctor to see how that can happen. So we try to kind of connect the dots between your concerns. So that way we try to figure out how is the puzzle pieces fitting together. So a lot of times in Western medicine, they use a lot of invasive methods like surgery or even organ removal or harsh medications with a lot of like side effects. And with naturopathic medicine, we try to be a little bit more gentler, non-invasive methods and try to be more proactive and preventative. So this is where I truly believe that seeing a naturopath before you reach out to a medical professional might be better, especially if you're in an earlier stage of a illness or symptoms, because that way we can try to see, can we use more proactive preventative methods to help you before we have to resort to these harsh invasive things. So let me give you an example. Let's say a patient comes in complaining about chronic diarrhea or constipation, for example. So we'll try to figure out, are there any food sensitivity issues? is there something wrong with the diet? That do you just need more fiber, or do you just need more digestive enzymes, for example? And we try to figure out how can we heal it through that. And before we try more invasive methods like surgeries or needing some certain medications. So this is where you doing naturopathic medicine can coexist hand in hand with Western medicine, where we can try to see what's the root cause, but while also trying to help the symptoms. And let's say if it is becoming a little bit more serious, then we of course refer to Western medicine to see we need more imaging and to figure out what's going on. Another thing with Western medicine is that the medications can have a little bit more side effects, like, a little bit more serious side effects, because these are stronger medications. And yes, some people do need these stronger medications when they are more sick, right? I'm not denying that. But so with naturopathic medicine, the medication that we do give tend to have fewer side effects and can experience more benefits, especially if you're earlier on in the illness and the conditions that you're experiencing. So this is where it's really, really pays to be proactive about your health, because if you are proactive, then you can kind of stop yourself from going down the road of needing to take multiple medications a day, and really having that priority of your health, and prevention, which can be so important, right? An ounce of what's an ounce of prevention is worth a pound of cure, for example. So so this is like a little bit of a differentiation between how Western medicine treats patients versus how naturopathic medicine can treat patients, so that you can understand the difference between the two, and so that it can hopefully be a little bit clearer for you. And if you do have any questions, I'm always available for a meet and greet, or to answer to see if your concern can be helped with naturopathic medicine, or if we need to refer you to do more testing, or to do additional blood work and things like that with your family doctor, for example. So this is where I also love advising patients as well, because the first oath in Naturopathic Doctor oath is to do no harm. So to make sure that whatever treatment that is offered to you is the one that causes you the least harm at the end of the day. So let's go to the next slide. I believe this comes to the modalities that we use in naturopathic medicine. So you can see that we use a whole range of different therapies. So a lot of my patients end up leaving the session with maybe some acupuncture done, with some diet help, and also some suggestions, some supplements, and even they could leave with some botanical medicine or even homeopathic medicine too. So there's a whole range. And I know a lot of times when you go to your family doctor, you just get you might leave with a prescription. So that's like one medication. So with a naturopathic doctor, you might leave with a different ways of healing, because we want to incorporate the healing power of nature into your therapies as well. And another thing I do often see with supplements is that a lot of times a lot of people take in too many supplements that they don't really need, because they saw it on internet, or they just saw an ad for it and then they just decided that this is good for me. But a lot of times, even taking too many supplements can be bad for you, because we don't know how they're interacting with many kind of medications that you might be on, or interacting with each other. So this is where you can actually bring your supplements with you, if you are taking a lot of them, so that way I can help you to figure out what do you really need. And I have had some patients that brought in like bags of supplements that they're taking, and they've been taking for years, and now they're piling supplements on top of each other, and they're just like not aware of what to remove and what to keep taking. So this is also where getting that advice from a trained professional can really help you to cut costs, and also just to kind of make sure that you're not taking too many supplements that are causing unnecessary harm possibly. So this is the big the way that I can help patients is through education, through all of these modalities, and also helping them navigate the medical system as well. And the difference between a homeopath versus a naturopath in this sense is that there is a lot more as a naturopath that I can do compared to if I were a homeopath. And not to say that that's like anything bad at all, because there's some amazing homeopathic practitioners that have done such good work. So, but I personally prefer to be a naturopath because of all of these modalities and all of these tools in my toolkit that I can offer to my patients. So I hope that that was very clear for you, or that gave you a lot of more information about what is the difference between homeopathy and naturopathy, and as a naturopathic doctor, what I do and why I do it as well. And if you do have any questions, you are totally welcome to either talk to me at the clinic or message to in the numbers at the front, in the beginning of the slides, so that way I can clarify a little bit more of the things I mentioned. So thank you so much for joining, everybody, and I hope you have a wonderful rest of your evening.
Awesome. Thank you, Dr. Udani. So, like Dr. Udani said, if you have any questions about any of the topics, or if you would like to book an appointment with Dr. Udani, feel free to give our office a call. She does do meet and greets, which is amazing. Well, lastly, so hopefully you guys got a lot of great information. Just don't forget to connect with us on Instagram, Facebook, and YouTube. And you could always visit our website for any further information about our office. So we hope to hear or hope to see you guys soon for our next talk. Bye, guys.